Now let's see how would we jot down the differential diagnosis in such patients. Both clinically and radiologically, BOOP mimics a variety of other pulmonary abnormalities. Clinically, we have a patient with fever, non-productive cough, malaise, dyspnea, that is difficulty in breathing, and weight loss. It can be due to numerous causes. Radiological findings can help us narrow down the list of the possible causes to a more manageable number. But definite means to confirm it is the histological examination. The similarities with the symptoms of some other disorders can often lead to misdiagnosis. Let me give you a tip. You should consider BOOP in patients in whom you suspect a pulmonary infection, but they fail to respond to antibiotic therapy. As I've already discussed that although the term pneumonia is used, BOOP is not an infection. If we talk about the disorders with similar symptoms, firstly, we have idiopathic pulmonary fibrosis, which is a fibrosing and inflammatory lung disorder, that too of unknown origin, or we can call idiopathic, characterized by abnormal formation of scar and fibrosis between the spherical alveolar structure in the lung, is referred to as the interstitium. These disorders are also called the chronic interstitial pneumonias. Now, the major symptoms over here include the shortness of breath, first of all mild, and then it becomes severe with the passage of time. Cough sometimes occurs. If disease is severe, the skin may appear slightly bluish. That is, the patient is cyanotic due to the lack of circulating oxygen. Complications like infection or heart problems may develop in these patients. The BOOP process may be sometimes seen in IPF as the inflammation component. In this situation, the BOOP is secondary to the underlying IPF disorder, and treatment with prednisone may eliminate the BOOP, yet the underlying IPF still continues. Now, the second one is the acute interstitial pneumonia, which is an inflammatory lung disorder that progresses rapidly and is distinguished by the particular nature or pattern of cells found on biopsy of the lung. This pattern is almost identical to that found with acute respiratory distress syndrome or ARDS, and may even be confused with such a condition.